I want to share an anonymized story of a patient I met last week. This is Thomas. Thomas was in his late 60s, quiet, independent, still driving, still gardening, still walking his dog every morning. By all accounts, he was doing well. He had high blood pressure and cholesterol, but otherwise lived a fairly normal life. About a week before I met him, something strange happened. He was making tea in the kitchen when suddenly his right hand became weak. The mug nearly slipped from his fingers. At the same time, his speech became slightly slurred. His wife asked him if he was okay, but within about 10 minutes, it had completely disappeared, gone, back to normal. Thomas laughed it off. He told himself he was tired. Maybe he'd stood up too quickly. Maybe his hand had gone dead. Maybe it was stress. And this is the dangerous part, because transient ischemic attacks, TIAs, often disappear before people realize how serious they are. A week later, Thomas woke up unable to move the entire right side of his body. This time, the symptoms didn't go away. He had suffered a major stroke, a devastating stroke that left him unable to walk independently, struggling to speak, and needing help with basic daily activities. And the heartbreaking part, there's a very good chance this could have been prevented. Today, I want to talk about the symptoms of a TIA, sometimes called a mini stroke, because these are warning signs your brain may give you before a catastrophic stroke happens. This is information Thomas wishes he knew. And if you remember anything from this video, remember this. A TIA is a medical emergency, even if the symptoms disappear, because your body may be giving you a final warning before something far worse happens. And the frightening thing is this. The risk of a stroke is highest in the hours and days immediately after a TIA, not months later, not years later, sometimes within 48 hours. So let's go through the warning signs people commonly ignore. The first, and probably the most important, is sudden weakness on one side of the body. This might be weakness in the arm, weakness in the leg, or weakness affecting the face. People often describe it as, my arm suddenly felt heavy, my leg wouldn't move properly, my face felt strange, I couldn't grip properly. Sometimes the arm drifts downward when lifted, sometimes the mouth droops slightly, sometimes walking suddenly feels awkward or unsteady. And because TIAs often improve quickly, people convince themselves it couldn't have been serious. But sudden one-sided weakness is one of the biggest red flags for a TIA or stroke, especially if it comes on suddenly. That word matters. Suddenly. Not gradually over weeks, not a mild ache building over months. A sudden neurological change. The second major warning sign is speech disturbance. This is incredibly common and incredibly dangerous to ignore. Some people suddenly can't get words out properly. Others know what they want to say, but the wrong words come out. Family members may notice speech becoming slurred. Some patients describe it as, my tongue stopped working. I sounded drunk. I couldn't get my words out. Again, if this happens suddenly, even if it lasts only a few minutes, you must treat it seriously. Because transient speech problems are one of the classic symptoms of a TIA, and they can be the warning shot before a major disabling stroke. The third symptom is sudden visual disturbance. This can happen in different ways. Some people lose vision in one eye temporarily, almost like a curtain coming down over the eye. Others describe blurred vision, double vision, or partial loss of vision. One patient once told me, it was like somebody switched the lights off in one eye for 5 minutes. That temporary loss of vision can be caused by reduced blood flow to the retina or brain, and it can signal disease in the carotid arteries, the major blood vessels in the neck supplying the brain. This is something we take extremely seriously in stroke medicine, especially because some patients will experience this warning sign days before a major stroke occurs. The fourth symptom is sudden numbness, particularly numbness affecting one side of the face, arm, or leg. Patients often dismiss this as a trapped nerve, poor circulation, I slept funny. And yes, numbness can happen for many reasons. But when numbness appears suddenly, especially alongside weakness, speech problems, or facial droop, you must think about TIA and stroke. The fifth warning sign is sudden imbalance or dizziness. Now this one can be difficult because dizziness is common. Most dizziness is not caused by stroke, but certain types of dizziness absolutely can be, particularly when dizziness comes with double vision, difficulty walking, slurred speech, weakness, loss of coordination, or sudden inability to balance properly. People may suddenly veer to one side while walking. They may feel unable to coordinate movements, or family members may notice they suddenly appear extremely unsteady. These symptoms can suggest involvement of the back part of the brain, what we call the posterior circulation, and posterior circulation strokes are often missed, which makes them especially dangerous. Another symptom people sometimes ignore is sudden confusion. Now, confusion by itself can happen for many reasons, but a sudden inability to understand language, sudden difficulty following conversation, or sudden inability to express thoughts properly can absolutely represent a TIA. Sometimes patients appear not themselves. Family members notice something is wrong before the patient does. That's why loved ones are often critical in recognizing stroke symptoms early. And this brings us to an important point. A TIA is different from a stroke, mainly because the symptoms fully resolve. But biologically, the underlying problem is often very similar. In both cases, blood flow to part of the brain becomes interrupted. With a TIA, the blockage clears quickly enough that symptoms improve completely. With a stroke, the blockage persists long enough to cause permanent brain injury. But the warning is the same. The blood supply to the brain has become unstable, and unless the cause is identified and treated, the next event may not resolve. That's exactly what happened to Thomas. His brain gave him a warning, but because the symptoms disappeared, he assumed the danger had passed. In reality, the danger was only beginning. So when should you seek help? Immediately. Not tomorrow. Not after speaking to a friend. Not after seeing if it happens again. If you develop sudden stroke-like symptoms, you should seek urgent medical attention straight away, even if symptoms improve. In the UK, that generally means calling 999 if symptoms are ongoing or severe. Because if it is a stroke, every minute matters. There's a phrase we use constantly in stroke medicine. Time is brain, because millions of brain cells die every minute during a stroke. Now here's something extremely important. Many people think, the symptoms went away, so I'm fine. No, you may have narrowly avoided a devastating stroke, and the period immediately after a TIA is one of the highest risk times for suffering a major stroke. This is why rapid assessment is critical. So what happens when somebody presents with a suspected TIA? Well, first, doctors will want to understand exactly what happened. The timing matters, the symptoms matter, how long it lasted matters, whether symptoms affected speech, vision, weakness, or sensation matters. Because not every episode of dizziness or numbness is a TIA. There are conditions that can mimic TIAs. For example, migraine aura, seizures, low blood sugar, inner ear problems, functional neurological symptoms, fainting episodes. But because stroke is such a serious diagnosis, we take these symptoms extremely seriously until proven otherwise. Patients will often undergo brain imaging, usually a CT scan initially, sometimes an MRI scan. MRI is particularly sensitive for detecting small areas of brain injury. Doctors may also perform imaging of the blood vessels supplying the brain. This is incredibly important because some people have significant narrowing in the carotid arteries. These are the large arteries in the neck supplying blood to the brain. If severe narrowing is found, some patients may benefit from procedures designed to reduce future stroke risk. Heart investigations are also very important because one major cause of stroke is atrial fibrillation, an irregular heart rhythm. In atrial fibrillation, blood can pool inside the heart and form clots. Those clots can then travel to the brain. Some people don't even know they have atrial fibrillation until after a TIA or stroke occurs, which is why ECGs and prolonged heart monitoring are often performed. Blood pressure will also be checked carefully, because high blood pressure is one of the biggest stroke risk factors worldwide. And unfortunately, it often causes no symptoms whatsoever. Many people walk around with dangerously high blood pressure for years without realizing. Cholesterol levels are also assessed, because cholesterol contributes to plaque buildup inside arteries. Over time, these plaques can rupture or narrow blood vessels enough to reduce blood flow to the brain. Blood tests may also look for diabetes, because diabetes dramatically increases vascular risk, especially when combined with high blood pressure, smoking, or high cholesterol. Now let's talk about treatment, because the good news is this. TIAs give us a chance to intervene before disaster strikes. One of the first treatments many patients receive is antiplatelet medication. This helps reduce clot formation. Aspirin is commonly used initially. Some patients may require dual antiplatelet therapy for a short period, depending on the situation. Others, particularly those with atrial fibrillation, may need anticoagulation medication instead. These medications work differently and are chosen carefully depending on the underlying cause. Blood pressure treatment is also critical. And I want to stress something important here. A lot of people stop blood pressure medication because they feel fine. But high blood pressure damages blood vessels silently. Stroke prevention often means treating conditions before symptoms appear. Statins are also frequently prescribed, not simply because of cholesterol numbers alone, but because they help stabilize plaques inside arteries and reduce future vascular risk. Smoking cessation is absolutely crucial. Smoking damages blood vessels, accelerates plaque formation, and increases clotting risk. If you smoke and have experienced TIA symptoms, stopping smoking may be one of the single most important decisions you ever make. Diet and exercise also matter enormously, and I know people sometimes roll their eyes when doctors mention lifestyle. But the reality is this: stroke prevention is often cumulative. It's the combined effect of blood pressure, diabetes, smoking, inactivity, obesity, poor sleep, cholesterol, alcohol excess, and vascular health over many years. Small improvements across multiple areas can dramatically reduce stroke risk. Regular physical activity improves blood pressure, insulin sensitivity, vascular function, and heart health. A Mediterranean-style diet, rich in vegetables, olive oil, whole grains, fish, nuts, and fiber, is associated with lower cardiovascular risk. Sleep also matters more than many people realize. Conditions like obstructive sleep apnea significantly increase stroke risk, particularly when untreated. So if somebody snores heavily, stops breathing during sleep, wakes exhausted, or has resistant high blood pressure, sleep assessment may be important. Now, there's another important point I want to mention. Not every TIA looks dramatic. Some are incredibly subtle. A 5-minute episode of speech difficulty, temporary hand clumsiness, brief visual loss, a short-lived facial droop, and because symptoms vanish, patients often feel embarrassed seeking help afterward. Please do not ignore these symptoms out of embarrassment. I would far rather assess 10 patients whose symptoms turn out not to be a TIA than miss one person heading toward a catastrophic stroke. And neither should any responsible doctor. Now, sadly, some people watching this may already have experienced a TIA and never sought medical attention. If that's you, please speak to your doctor, particularly if you have vascular risk factors. Because even if the episode occurred weeks or months ago, identifying risk factors can still reduce future stroke risk. And finally, I want to come back to Thomas. When I met him after his stroke, he told me something that has stayed with me. He said, "If I'd known that first episode was a warning, I would have gone straight to hospital." That's why videos like this matter, because stroke medicine isn't only about emergency treatment, it's about prevention. It's about recognizing the warning signs before irreversible damage occurs. A TIA is not your body overreacting. It's not just stress. It's not getting older. It may be the only warning you ever receive before a life-changing stroke. So please, if you or somebody around you develops sudden weakness, facial droop, speech difficulty, sudden visual loss, or sudden neurological symptoms, take it seriously, even if it disappears, especially if it disappears, because the next one may not. And if this video helped you, please share it with somebody you care about. You genuinely could help save a life.